Good afternoon, everybody. Today we have Jason and Paul with Zing Health. They are going to go over their 2025 product information with a fairly large expansion for this year. So I'm going to ask them all the questions for your benefit. And then if I miss anything, these fun little QR codes right here, I'm sure are going to take you to Jason and Paul's contact information so that you can ask them more detailed questions. But outside of that, I'm going to give it to you guys and y'all can take it away.
Excellent. No, thank you, Courtney, and NCC. As an entity as well. Thank you all for taking the time out of your day to hear what we have to say, because we really are pretty darned excited. And I'll give Paul here the floor before we get too in depth on things. Paul, you want to introduce yourself, and then we'll kind of take it from there.
Sure. Thank you, Jason. My name is Paul Richardson. I am the regional account manager for the state of Tennessee and also Mississippi. So we are very, very excited that Miss Courtney and all the people with NCC have given us an opportunity to help you grow your business. And so it's just my job, and with Jason's poking and prodding to make sure everything gets done according to the way that Zing Health wants it to get done. We're going to make sure that we grow your book and just have a good time doing it. So thank you so much for the time, and look forward to working with you. Back to you, Jason.
Yeah, no, that's great, Paul. And Paul's one of our newest members of the team. Really excited to have him there in Tennessee and Mississippi. Just done a wonderful job right out of the gate. Knows the industry well. He's been in the business for a very long time, as have I. We've both been brokers, by the way, outselling products. So we have intimate knowledge of what you all go through on a day-to-day basis. I started Zing Health back in 2020. The inception of the company actually came about in 2019, however, in one lonesome county in County, Illinois, Chicago, to be exact. And when I joined, we decided we were going to, jump in headfirst into a couple of other expansion states and kind of launch the 1099 channel. And since then, I'll tell you what, we have seen tremendous growth as we found our footing in not just general enrollment space, but more precisely in the CSNP space. And as you all know, the landscape of SEPs is changing in 2025, especially in that LIS and Medi world. And so what you're going to see is some compelling reasons, I'd say, to ensure that you kind of lean into the CSNP space, because you're going to have an opportunity to sell these plans year round. And again, like I said, we'll dive in a little bit more to that. But what you see in front of you here is Dr. Whitaker is our founder and CEO, and in 2017, when he kind of came up with this idea, and he always kind of jokes how he came up with the name Zing. He was in the shower, which is where he does some of his best thinking. He jokes, but it is a catchy little name. Sometimes you'll have to kind of get over that hurdle as a new carrier into the space. But we are entering our sixth season, so excited about that. Key differentiators for Zing Health in all of our markets, quite honestly, not just in CSNP, but also in general enrollment spaces. We really lead our markets that we're currently in with competitive drug pricing, free key medical devices, and supplemental benefits such as grocery, OTC, card, transportation, and whatnot, that really speak intimately and to the social determinants of health and impacting those. Dr. Whitaker is born and raised in Chicago, and so he's had firsthand knowledge over his life of witnessing things such as food deserts, right? Access to care issues for a number of different reasons, and so he's very thoughtful, as he launched this company, and then as we started to really focus our attention into that CSNP space. So today we're going to kind of talk a little bit about, again, our vision and strategic overview, again, around differentiated product designs. But I think probably most importantly is a leading customer experience, where we use a lot of partners to offer wraparound services, and then also to kind of get in front of things as folks not only on board with us, but then as they start to realize that, the access to their benefits is wide open with Zing Health. They can use their food card from day one. They're not having to wait for that verification or anything like that. And transportation, again, on all of our HMO products. We have an integrated care delivery system that, again, uses in partnership some of those vendors. We'll talk about those later today in the presentation, but really ensuring that, a smooth transition onto a plan. We all know that sometimes, that can be a little hairy, right? So we'll touch on that. And then also robust sales and marketing, which really speaks directly to what you do out in the field, because let's face it, quite honestly, when a beneficiary is in front of you and you're, putting Zing in front of them, you are the face of Zing. It's not Paul. It's not myself. We are, just a small piece of the puzzle. But they're really putting their faith in the company through you. So we'll spend a lot of time on the educational piece, as well as offering, our support to you as you're out in the field. Now, in terms of our overview, I mean, we are regional. And again, we're 6 years old. So those first couple of years were pretty rocky, right? Trying to get folks' attention and brokers out there to, not only understand our path and our focus, but, simply just to kind of dip their toe in and write an application or two. But I'm really excited to say that in January 1st of 2023, so let's go back a year and a half here or more, we had about 3,100 members. And at the beginning of this year, January 1st, 2024, we had tripled in size to 9,600 members. Well, I'm really excited to say that, since February of this year until July, we hit 13,000. And actually, as an organization, we've had our busiest months in the last 3 months and we built on that, out of any month ever in the history of the company, outside of AEP, of course. So we broke our record in June, we broke it again in July, and we did it again in August. So tremendous growth. And that's during lock-in. Imagine, right? Like, we have seen the most growth as an organization during the time when most agents or at least some of them anyway, are taking vacations, catching their breath, getting pulled, in different directions in terms of certifications and learning about the new products. And yet we're growing at a tremendous pace. And most of that is in the SNP space. We do offer D-SNPs in Michigan, one of our current states. And then we offer dual focus plans in our C-SNP products in all markets. And that's how it's going to be in 2025 as well. Here's just a real high level idea of our expansion. And, as a regional carrier, opening 3 new states in 1 year is tough enough for a large carrier, right? A national carrier. But we're doing it. We're doing it really well. You'll see county expansion in Illinois, Indiana, and Michigan, where we're doubling our footprint in counties. We're going to be in the Cleveland and Akron marketplace, as well as Nashville, and then Memphis, and again, across the border into Mississippi for 2025. So in terms of the product portfolio, this is a great idea of really kind of, what we're offering in all markets almost. I mean, the PPO will kind of, you'll have to be a little more strategic with the PPO in certain states, but we offer HMO products, HMO PSP. We'll talk about what that provider-specific plan and strategy looks like here momentarily. As I mentioned, D-SNP plans as well in the HMO and PPO space there in Michigan. But along the bottom, this is, going to really kind of show you how deep we go into the C-SNP space with HMOs, HMO PSPs, dual focus HMO C-SNPs, and PPO C-SNPs, and also a dual focus PPO C-SNP in Indiana and Tennessee. Now, something else that we launched over a year ago was an ESRD C-SNP, and that's very unique in the marketplace. You just don't see MAPDs focused in that C-SNP category on the ESRD condition. But we found footing in that space. We're doing a great job of providing care and really strong benefits. Now, it's a small percentage of the population, but again, you're going to see here momentarily why you need to consider that when you get out there and run into folks with end-stage renal disease. Now, like every carrier, we have to, identify different buckets where we want to kind of put our money, right? And, pretty typical in the space, right? $0 premium plans. We have PPO, cost share parity, which is a passive PPO, some folks will call it, where, whatever you pay for a copay in network is going to be exactly what you pay out of network. Of course, we go really deep into that food and utility benefit. And if we're not leading the pack in all of our markets, we're definitely coming in at 2. But right now, in the 3 states we're currently in, we lead the market in all of our service areas. We have some CSNP enhancements for 2025, which again are kind of focused on the OTC food and utility benefits, but also a very unique Part D Tier 6 formulary that is a 0 copay for some really key CSNP related drugs, lower specialist copays and really quite honestly, it's $0 copays for specialists, for CSNP specific specialists. So a really great chronic meal benefit. We have some allowance improvements to include flex cards on most of our plans, all of the HMO products, and then some competitive MOOPs. Now, we all know that, rarely, it's a very small percentage of people reach their MOOP in a year's time. But strangely enough, folks like to, shop based upon what their maximum out of pocket, trying to, reduce that exposure to risk. Now, in terms of our plan types, again, I've already mentioned HMO and PPOs there on the left, the DSNPs, the CSNPs, the dual focus CSNPs, and then the ESRD products. We're going to cover these at a high level, but I'm still going to show you the grids for all states. But let's take a step back, kind of look at, again, how focused we are in that CSNP space and identify, again, some of those key categories, such as transportation on all of our HMO products. The $0 copays, as I mentioned earlier, of the CSNP specific specialists. We offer that Tier 6 formulary, as well as a Tier 1 $0 copay formulary. Something else that I'm really proud of, and we've been actually partnering with PAPA for the last 3 years, and that's been a key driver in our strategy. And PAPA, if you're not familiar with them, provide in-home support services such as transportation for errands, light housekeeping, meal prep. They even help you understand technology. Heck, in the Chicagoland area, when we get snow, they will even shovel your sidewalk. I mean, that's how extensive it is. And that benefit is on all plans for our HMOs and our CSNPs. Now let's talk real briefly about, why we got into the space, because Dr. Whitaker identified the need early on, but it wasn't until our actuaries looked at the numbers and said, hey, wait a second, there are about 32 million Medicare Advantage beneficiaries across this country. Yet, and the prevalence of the conditions that you see there, diabetes, chronic heart failure, and ESRD, is high, right? Like, look at those percentages. They're 12, probably 13, maybe even 14 million by now. These numbers are a little old, I'd say maybe a year and a half is where we had this as far back as we could go. But on the right-hand side, 600,000, less than 1 million people are actually enrolled into a CSNP. Yet there's, 12, 13, 14 million people with a chronic condition, but they're all enrolled in general enrollment plans. They're not enrolled into a CSNP. So imagine that. They're not in a plan that's designed to better help them treat their condition, to help them live healthier and happier lives with benefits that are strategically designed to treat their condition and create a roadmap for them, again, to become healthier. And that benefits the members, as you can see here. Providers love it. In our current footprint, as soon as they identify a Zing patient and member, they actually start to engage with us at a higher level, and we do with them as well. We are a very tech-forward company when it comes to sharing data. And then brokers, as I mentioned, year-round sales opportunities with lower churn than the DSNP space. And then again, those differentiated product benefits. Now, I mentioned, the enrollment periods, right? Because I'm not sure if everyone really understands, how impactful this is going to be for 2025. But, the LIS population, the DSNP population, are going to be very limited throughout the year moving forward when it comes to enrolling in a different plan. Should they make, have a change in their health, maybe they made a poor decision and they want to get out of it and try something else. With the CSNP products, you can enroll folks year round in 2025, right? Based upon the condition that they have. It even includes, when I always tell people, when the pencil drops in December 7th, right? And no one else can write any business with the CSNP plans, you can actually continue to write business all the way through the end of December. So, if someone calls you on December 8th and they say, hey, you know what, I made a bad choice, or I didn't quite get my selection in on time. Can you help me? Well, if they have a chronic condition, they're going to be able to enroll into one of our plans. And lastly, if you look at the growth year over year, DSNPs are that darker line there. And, let's face it, I mean, the DSNP space is crowded and a lot of carriers really chase that business for years. But it really wasn't so in the CSNP space. In fact, most CSNPs are not really richer in benefits, and they don't do a great job of actually treating the conditions, quite honestly, than a general enrollment plan. But this last year, CMS got it. They saw the path and they understood it. And quite honestly, Health did too. And so we launched our products in 2022. We were part of this growth, this 42% year over year in the CSNP space. And that's going to get more dramatic this upcoming year. I guarantee you, with those reductions in the SEPs. Real quick, let's pivot back to kind of plan design though. We've got PSPs. I mentioned those earlier, right? We have HMO PSPs, we have CSNP HMO PSPs, provider specific plans. They work on a narrower network of primary care physicians. And the reason for that is that we actually partner with value-based care entities such as Oak Street Health. In fact, I think it's every single county that we actually do business in for 24 and in 25. There's an Oak Street Health clinic where a PSP plan, like we're mentioning here, is offered. So if they enroll into a PSP, it's going to have a little bit richer benefits, but they're going to have to go to their primary care for Oak Street. Now they can see a specialist within our network, that's outside of Oak Street, but again, they must go to a value-based care PCP. Now, in terms of our dual focus CSNPs, and let's talk about that briefly, because these folks, you got to make sure they have that QMB plus or QMB plus, SLMB plus, those full benefit dual eligible folks. They cannot have a spend down, and it varies state by state. So you have to be intimately kind of up to speed on what your state is offering, with the HIDEs and the FIDEs and all of this stuff, right? It's a lot of education that you have to do so that you can help your folks get into the correct plan. But let's remember, with our dual focus CSNPs, you want to make sure that they don't have a spend down. Otherwise, they will be exposed to that 20% coinsurance, okay? Now, it goes without saying, we also have CSNPs where you don't need Medicaid, though. And that's really been the big boon. If you can imagine the people just above those income thresholds, right? There's a ton of people out there on fixed incomes that don't have Medicaid, that don't have LIS, and they're hurting. They're hurting bad. Prices are going up and their incomes are staying the same. And you're going to get that opportunity as well. So a quick overview of the ESRD plans. Again, I mentioned these are very unique in the marketplace. And just a few years ago, someone with ESRD couldn't even get into a Medicare Advantage plan, if you remember correctly. Well, we launched this last year. It's been very successful in Indiana and Michigan. It's the two states that we actually launched this with. And if you can believe it, these plans offer $0 copay for dialysis and nephrologist visits. So again, and remember, and just they don't have to have Medicaid to be on this plan. So imagine someone above those income thresholds I don't know if you've priced out a dialysis visit, but I have, and it runs even at that 20% coinsurance between $150 and $200 a visit. And sometimes people go to dialysis once, twice, even 3 times a week if it's really severe. So imagine the savings that someone realizes once they get onto this plan, not to mention unlimited transportation as well for dialysis. I mean, that's a key driver, right? In getting someone to dialysis. They go through that 3-4 hour process, however long it takes them, and then they can't drive after that. They are exhausted, so they need transportation, and this has again been a winning recipe for us in this plan. We also offer PPOs. Again, they're passive. In and out of network cost share parity. We also have combined in and out of network MOOPs as well. So very, very competitive in the marketplace, and they do serve a need. As I mentioned, 3 new states, 18 new counties. We're in 43 total counties with a 40% increase in total addressable market. We are hitting it hard, and it's only because of the foundation that we've built in the space. In terms of our plan names, there is a little bit of thought put into that, right? You'll see on the left the plan types that we offer, but there are keywords that are associated with those plan types. So if you kind of scroll down past the HMO and PPO plans, you'll see the PSP. Well, there's a keyword of elite in there, right? So if you are kind of doing your searching and you come across our HMO and PPO and it has the word elite in it, that those are the types of plans where someone's going to go to Oak Street Health for their primary care, and so on and so forth. Okay, I know we're kind of winding up an hour. I've got a bunch of more slides, Courtney, but let me just kind of flip through a few of these, just a real high level, point out that we have 0 copay for nurse advice hotline and telemedicine. At the bottom here, we have a rewards and incentive program where folks, again, pretty kind of standard in the industry, but they can earn additional money where they can spend just about anywhere if they get their colonoscopy, their mammogram, their yearly checkup, that type of thing. Here's a quick oversight of or overview, I should say, of our over-the-counter partners. The Walmarts, the CVS, the Walgreens of the world, as well as a ton of grocery listed here as well. So they can go there. They can also order OTC items through a catalog as well. They can also do that with food. We offer fitness memberships on all plans, Silver and Fit. We offer a voucher for a free membership to Weight Watchers. If you price that out, it's over $100 a year. Dietary and nutritional counseling, as well as medical nutritional therapy. We got the Pop-It at the top. We offer PERS on all of our CSNP products. And then something else that we've had since day one as a company, bathroom safety devices. Typically, these things are high ticket items in OTC in the catalogs. Think shower wands, grab bars, shower benches, things that are higher ticketed items. We offer 2 of those to every single Zing Health member every year. You can get up to 2 at 0 copay. And that doesn't come out of your OTC. It's a carve out. The utility allowance covers electric, gas, heating oil, sanitary, and water. Remember, it does not include gas at the pump. But if they get those reward and incentive dollars, they can actually use that at the pump. So if they get their mammogram or their colonoscopy, that one MasterCard will work if they want to spend it that way. Something else to remind you of, again, as I mentioned, we got transportation on all of our HMO plans. But just keep in mind that even on the PPO plans, they can use their Papa benefit as a transportation service as well. Just scroll down to the bottom here. I guess in the middle, we do have 10 post-discharge meals that we've always offered, but this year we're also offering 28 meals for folks with chronic conditions. They meet with a dietary nutritional, like a nutritionalist. They identify their nutritional needs and what their restrictions are. And then those those meals are designed to kind of, again, address those, those restrictions. And they get 14 meals at a time sent to them, up to 28 in a year. As Dr. Whitaker is out in the, he's out there talking to agents and brokers. And in our first couple of road shows we ever did as an organization, when I was out there in 2020, agents said, "Hey, what about Viagra? A lot of my clients, want Viagra." So we added it to the formulary mid-year, actually. And so he always jokes, that we're here to put the Zing back in people's lives. But it is true. They get between 4 and 6 tablets a month, depending on what state they're in. So I challenge anyone to use that many tablets. Something else that we did since 2022, and again, this is on all plans, is we've offered $0 copay for CGMs, continuous glucose monitors. That also includes all of the supplies that go along with that, the adhesives and everything. $0 copay. Now, this is typically in a DME category, which they can get because we partner with ADS, but they can also just get a script from their physician and take it right to the pharmacy. And they can get their CGM right at the pharmacy if they want. They don't have to go through DME. It also partners with pumps. So we offer Libre Freestyle, Dexcom 6, Dexcom 7. So the leading brand names in the CGM marketplace. But we also offer a pump at a tier 3. So it's only $47 a month if you want an insulin pump. Price that out, and you'll find that that's usually, north of $150, pushing $200 a month for an insulin pump. So that's a key seller as well. Now, here's where it gets juicy. $0 copay for insulins, I mentioned earlier, right? Look at the extensive list of insulins we offer. We don't just pick a couple of them. Now, this isn't inclusive of all insulins, I'll admit that, but it is pretty extensive, and it even includes the pens, the injectable pens. And then something else to get excited about, we currently have this year in our CSNP products. So it's not like this is a shiny, just the shiny, benefit for 2025. We've already been doing this. We have a tier 6 on all of our CSNP plans. Look at what they can get at $0 copay. And this is going to be really impactful this upcoming year, because guess what? You all know that coverage gap's going away, right? The donut hole is no longer. So they can, think about a member in a CSNP plan, right? They're taking one or more of these medications, brand name meds. They're also seeing their specialists at a higher frequency. Think about the savings for those folks, again, that are above that LIS and Medicaid levels, the folks that don't have any help. Think of how much of an impact you can make when they're spending hundreds and hundreds of dollars out of their pocket every month to treat their conditions. I mean, Januvia, Ozempic, Trulicity, it's crazy. But it's a winning recipe. Now let's real quick pivot, and we're going to bring it on home now. We use Evolve as our broker portal. This is where you do your contracting, you do your certification, you track your book of business, and you look at your statements. But just as importantly, here's where our sales and marketing piece comes in. We have TGI Direct as our marketing partner, and our marketing team is just on top of it. They really are. They offer, and we offer brochures, flyers, postcards, thank you cards, holiday cards at no cost to you guys. And you can personalize them and put your name and phone number on them only. And we'll print them up and send them directly to you at no cost. You also want to make sure you get your pre-order for your 2025 materials. Those are going to be shipping out here on and around the 27th of September. We even have a Facebook social media guide and it shows you screenshot by screenshot how to set up a business account. And we have CMS approved drip campaigns that are focused on CSNP, focused on food card, focused on LIS, focused on aging in. And we take you step by step on how to do that. We use Ascend as our online enrollment tool. If you go to our website, that's where you're going to be directed. But we also work with Connecture and Sunfire, and we even take good old-fashioned paper. If you go to zingfirstlook.com, All those grids that I showed you earlier, as well as a bunch of other information, is already posted online. zingfirstlook.com. And this is where we'll bring it home. I'm not going to spend a lot of time on this, but these are our wraparound services. Advanced Diabetes Supply in the middle, City Block, Strive Health, Perry Health, and Story Health. All of these providers engage with our members at a higher rate to help them treat their conditions. Now, there are some exceptions to this. If someone's going to Oak Street, for instance, their value-based care, they're not going to get contacted by any of these companies. But ADS is a great partner. You already probably know this if you work with them, that, it doesn't matter if you enroll them today for an October 1 start date. You can call them up immediately and they will call that beneficiary today. And they will make sure that they have the diabetic supplies that they need prior to even becoming a member of Zing. They're a great partner. City Block, wraparound services around kind of more of a primary care, but they offer nurses, social workers, doctors, mental health providers, but they just basically help us work in step with their current PCP and to create a roadmap, even outside of the CSNP space. Because guess what? We have Perry Health to do that for our diabetics. So they reach out to all of our folks suffering from diabetes and help, again, create a roadmap for better treating their condition. Story Health does it for all of our cardiac members. They even offer scales, blood pressure monitors, things like that. It's very, very important, I think, for folks if they're suffering from these conditions and they don't really even know what they have a lot of times, but to understand how to treat them and how to better control them. And then Strive is a great partner around ESRD. So as you can see today, we cover the entire gamut, right, of products and supplemental benefits as an organization, and we mean it. We actually walk the walk. Now, you don't see Paul's name up here, and I'm sorry I don't have that slide up, Paul, but you had his QR code earlier, but we have people in every single market. Alex Gutierrez in Illinois, Sarah Newman, Indiana, Ryan Combs in Michigan. We're in the final stages of adding someone for Ohio as well. And then there I am on the left. I cover all markets. You can scan these codes and get all of our contact information and reach out directly. We even have a marketing outreach team. We have people in every single market. You can contact these people. They're out marketing brand awareness. We're doing the diabetes walks, doing the Alzheimer's walks, doing the health fairs, and they're creating opportunities for brokers. So if you want to get plugged in to events, we are solely focused on the 1099 channel here. We don't have W-2s. We have a few in Illinois, just a handful. Everywhere else, and even in Illinois, we have far more events than we can even manage. And that's no joke. So if you want to sit events and do grassroots marketing, think of us and come to us, and we will work in partnership with you to grow your book of business. Again, here's our QR codes of Paul and mine. Really, I just want to thank you for sitting through what is, a little more than an hour of your time, but we're there at the end. Courtney, do you happen to have any questions for me or Paul?
I don't. I think you covered it fantastic. The CSNP is, for lack of better wording, going to be the new DSNP as far as enrollments are concerned. And honestly, a lot of the DSNP clients fit the CSNP mold, and they'll actually get a whole lot of more benefits that will actually help them be healthier in the long run with a CSNP plan. So these are some really cool, very niche products that I think a lot of agents will be able to add to their portfolio.